Hi, everyone. Thank you so much for joining us on a podcast that is here to help you figure out how to maximize your own mental health, what's out there in the world for you and for all of us to get as many resources as we can, because times are challenging and we all need help. We all need support at some point. So today, I have a lovely guest, and this is truth. My guests are lovely. This is someone for whom I have appreciation and affection because she also happens to work with me. And I get nothing but lovely reports about this person. So let me tell you about Dr. Jayne Ehirim. Dr. Jayne Ehirim is a doctoral-prepared, board-certified psychiatric mental health nurse practitioner offering psychiatric evaluations, medication management, and psychotherapy to adults in Illinois, which, folks, if you're elsewhere in the country, that's where we're located. She received a bachelor's in health sciences administration and management at California State East Bay University and a Bachelor of Nursing Science and Nursing at Goldfarb School of Nursing at Barnes Jewish College, a Doctor of Nursing practice at the University of Missouri St. Louis with a dual degree certification as a family nurse practitioner, as well as a psychiatric mental health nurse practitioner. She completed her nurse practitioner residency at Places for People, a certified community behavioral health organization in St. Louis County. She has expertise in caring for people with depression, anxiety disorders, panic attack, and mood disorders. Dr. Ehirim has experience in working with people from diverse racial, ethnic, religious, and socioeconomic backgrounds. She provides holistic care that focuses on empowering her patients with the necessary support they need to improve their mental health and overall quality of life. So, welcome, Jayne, and thank you for providing that. I mean, that if that does not clarify for folks that you know what you're doing and you bring expertise, I don't know what would. So, thank you so much for being here today.
Thank you for having me. Thank you.
So, Jayne, folks, is one of our prescribers in our practice. What I want folks to hear about today is something that you do in addition. This is a project that you have with your husband that is, I think, incredible. You and your husband, Vincent, do videos on social, and you post those on social media that is about mental health and reducing the stigma around mental health. And some of it is just to help people live their best lives, be their best selves. Is that correct?
Yeah, yes, absolutely. Absolutely.
Wonderful.
You accurately put it. So my husband, Vincent Ehirim, and he has a mental health background as well, just like myself. And he studied counseling in school. He has a master's in counseling. And then myself, studied to be a psychiatric nurse practitioner. So we both have the passion to help people, right? We love knowledge, we love to learn, and it doesn't stop there because we are firm believers that knowledge doesn't end with you, right? You have to impact that to those around you to make society a better place. So it was this that led to our journey of like creating that positive environment, and not just that positive environment, and also creating more awareness when we are talking about mental health. Originally, we both, we come from Nigeria, which is a country in West Africa. And also, if you know anything about, the African culture or history, we don't talk about mental health. When we talk about stigma, it's at an all-time high in Nigeria. A lot of people are ostracized just because they are dealing with one mental health challenge or the other. And, even in our society today, you would think that, okay, things are advanced, people are more exposed, but it really does happen. And not just in Nigeria, but all over the world. People still have these myths about mental health and stigmatization that prevent them from seeking care when needed. So it is part of this dream and this vision to create more awareness and destigmatize, seeking mental health care, right? The importance of seeking mental health care. So that's what inspired our journey. to create that positive environment and not just to stop there. And when it comes to mental health, we want to make sure that people are knowledgeable enough to know when to seek care in the right places.
Mm, I love that, Jane. It really is so generous of you. I know you're busy because
Yes.
you work with me, so I get that. You're busy, and I'm sure your husband is busy too. But you take the time to do this, to put this content out so that people can benefit. And boy, you see it, and certainly we see it, I think, less here during the pandemic. The
Hmm.
stigma around mental health really diminished significantly, but not in all communities, not in
Yep.
all cultures. There are
Yes.
plenty where that still exists. And boy, I think having someone who is from a culture where
Hmm.
the stigma is still so potent, you have a deeper and different understanding than maybe somebody else who didn't come from that kind of environment. So
Yeah.
thank you as someone who, really is part of that journey too of trying to smash that stigma against mental health for putting that out there. So tell us a little bit about the platform. What is it? Or the posts that you do, what are they? How do you utilize them? How do you create them? How do you come up with your content? And what are some of the examples of topics people might hear if they were to tune in?
Okay, absolutely. Yes. So we create the content very intentionally, right? My husband and I, we research about where is the need, right? Where is the need in the society? Where is the need in the community? And talk about this, basic things happening in our everyday society. One of the biggest thing in terms of delivering our message is to ensure that we make it as simple as possible, right? So that people don't get like lost, listening to us, and they can, we try as much as possible to make it in a way that anybody can comprehend. You don't have
Mm,
to have a medical background to be able to comprehend. Just like talking to the next person, right? Anybody can comprehend. So that's one delivery way we apply when we are like sending out our messages. And then also some of the topics we've covered, right? Like, it's okay not to be okay, right? It's okay not to be okay. We do believe firmly that we cannot talk about mental health without talking about the stigmatization like that we are dealing with when it comes to mental health, right? Without talking about the need to be vulnerable when discussing sensitive issues like that. Also, we do believe that you need to create a safe space where people can have an open dialogue in order to have this conversation. Because guess what? Believe it or not, people are going through things, right? But they might not know the right or appropriate labeling to call it that thing. And so by creating this awareness, this post, and having this topic saying, it's okay not to be okay, right? I see you, I hear you, you're not alone in this. Let's talk about it, right? It gives them that opportunity not only to share their own life experiences and be vulnerable, but also to feel safe in the moment, but also to
mm,
feel safe. So we share this on our platform, Vibers Community. We call ourselves the Vibers Community, and we have a private group also on Facebook that we call Journey with the Vibes. And so
mm,
we have that particular group to discuss more sensitive issues whereby people might not be able to open up on a public platform. They can also
mm,
share that when we have mental health segments, they can also share that in the group as well. And then guess what? It's like a way someone else can see it and learn, right? Maybe I might not be brave enough to talk about it, but when I do see someone sharing their own story, and I do know that this is a no judgment zone and this is a safe place, then just maybe I will be able to take that brave step to seek help.
Hmm. Oh,
Yeah.
that's lovely. So it's an interactive platform. It's
Yes,
an interactive, that's the goal, is to be interactive in a secure
absolutely.
space. It's not, everybody on Facebook can see it or everybody on Instagram. It's not that. It's a private group with a small number of people, I'm assuming, whom you have vetted in some way and they've opted in.
Hmm.
And the goal, I mean, it sounds like you're not doing therapy, but you're allowing people to express themselves and maybe figure out what is this thing? What might it be called? Is,
Absolutely.
right? Because I mean, I can't tell you, my specialty clinically has been trauma. Very few people over 30 some years have come to me and said, look, I have trauma. They come to me and say, I'm depressed, I'm anxious, I'm irritable, I can't sleep. And then we do the assessment. So maybe part of what you're doing and your community doing is helping people find language to
Absolutely.
describe what's happening for them. Oh, this is a thing. This is kind of serious. This is where you can get some help. I love that.
Thank you so much. Yes, the right verbiage is everything. And so when you have the appropriate language, like you said, to place to what you're dealing with, that's when you recognize, what you're dealing with, then you could start
Mhm.
to work towards solving that or getting the right help for it. But when you don't know it, it's almost like being in like a bubble, right? Still not finding that direction. So yes, absolutely, I agree with you.
Mm, that's great. Well, and it's the purpose of this podcast is people don't know what they don't know. So
Yes.
they'll hop on, find a provider, they'll find a prescriber or a psychologist or a social worker or a counselor or marriage and family therapist or whomever, and we'll hope that's the right person for them based on maybe something they've read. But
Mm-hmm.
really, what you're talking about is there are very specific treatments that the science says will support anxiety. There are
Absolutely.
right? There are specific treatments for post-traumatic stress disorder that are more
Yeah.
effective and some that aren't. So you're helping people sort of parse that out and
Mm-hmm.
have the right language. So that is vital. And you know what, folks? First of all, we're going to have Jayne's information in the show notes. So you'll be able to get a hold of her and you'll be able to look at what her platform is and have a sense of what she's talking about or what her offerings are. Um,
Okay.
but if you don't know, don't worry about it. You don't have to know that you have anxiety, post-traumatic stress, or eating, you don't have to have the right language. Just, give a call to somebody, ask them what their experience is in treating these symptoms. You know your symptoms. That's okay.
Right.
So, Jayne, what would you say is these conversations, what role do they play in encouraging people to get help when they need it? Because that's really part of what you're trying to encourage when you're talking about mental health.
Right. That's a very good question. Thanks for asking that. So, uh, I think it's important for us to have conversations, right? One of the biggest ways we do this is by allowing people be who they are and meet them where they are, right? Everybody's at different stages in terms of like how much they know about mental health or even like their backgrounds or their needs and things like that. So conversations allow room for open dialogue, which is very important when we are talking about mental health. Conversation creates a safe space for the things that needs to be said. Conversation allows room to correct like the myths, to correct like maybe if there have been previous bad experiences and we want to correct those assumptions or like those wrong or those misinformation. Conversation helps to create those awareness. I do believe, that by having conversations, we are not only saying, you know what, you have to do this or this is this. Because, like I said, we have this barrier that we are dealing with to care, to access of mental health services. And first, we need to be able to break that before we start the healing process, right? And so, by having conversation, it's saying it's okay for us to have this dialogue. Come with what you know and let's put it on the table and let's talk about it. And as professionals, right, we can use that opportunity to correct, to educate, to create awareness. And hopefully, before we leave the session or before we leave that conversation, we have like a clearer view or an agreement of what this looks like, with facts, because in science, we don't do things based on, just because we follow evidence-based practice and things like that. So it's important that we are looking at those things when also spreading information or creating an awareness. So I do believe that anytime you're able to have those conversations, you're able to correct those misinformations out there, and it doesn't stop there. It helps to allow people to be more vulnerable to seek care.
Absolutely. And there is science to support the fact that something happens in our brain assuming we're not just getting, and this is a word, folks, that I think can be overused, but triggered by our own discussion, right? We can talk about things and some people can get kind of overstimulated and it's a little too much. But if we're not in that camp, which is often most of us, we're actually doing something to alter how our brain functions already. That relational piece of being with another person. I know there are therapy bots right now that have become very popular. And the science says, you know what, for some things, those things can be, it's better than nothing.
Right.
But boy, having a conversation that comes from somebody's heart, somebody
Yes.
who cares, who's
Yes.
invested, that can be so incredibly healing. And a bot may say the right words, but they have no heart. So they can't offer that, right? So
Yes.
I think that's part of what you're giving people in a virtual space is an opportunity to have a conversation with heart and to begin to change their brains just by talking about it, just by putting it down. So,
Absolutely.
right? So social media, I mean, we don't have to, I think everybody knows social media, it can be like opening up a fire hose on your face. It's like,
Yes.
boom, right? So what challenges have you noticed are you facing, or might your folks who are joining you be facing when discussing mental health in an online platform?
Okay. So yes, absolutely. We all know social media is the future. Everybody's on social media. At least majority of people are on social media, especially the young generation. If you can't get them, doing something, you'll probably get them with technology. But at the same time, as much as it's a very powerful tool in creating awareness and reaching like a large scale of people, it also can be very dangerous, right? Whenever we talk about misinformation, like you said, it spreads like wildfire, and someone can carry what they've heard and in all good conscience, and they might not know this and spread it around because that's what they know. And so that has been a major challenge, right? Whereby sometimes it's like people might, go online, either Google something up or follow a page or someone that they like their page or like what they do, and they follow their ideology or what they are saying. And then this kind of like makes it a little bit challenging for providers, like who have expertise in these areas and are trained for this, are skilled for this, in order for them to, kind of like, in order for them to make that difference. And so what is important is that we cannot give up, we cannot stop, right? Just as, we still have this wide misinformation out there, it's as important as ever to have our voices heard, right? To be able to correct it, to be able to educate. I do believe that whenever people know better, right, they have an opportunity to do better, right? And
Mhm.
so by knowing better, you're giving them that chance to have informed consent. That way they can know how to do better. Obviously, ultimately, the choice is up to them, but it's like a fighting chance and an opportunity to correct the misinformation. And also, when we are talking about like misinformation, we are talking about human lives, right? It could be very endangering, especially with the wrong information. We all know that mental health challenges are very serious, and if it's not taken care of, it could be very debilitating in itself. And so
Mhm.
it's very important that we don't give up regardless of the challenges faced on social media, but also to spread our voice. So some of those are like one of the challenges, like trying to correct those misinformation out there
Mhm.
already. And also, sometimes a lot of things people deal with are like barriers to care, not having the transportation, not having the right, finding the right doctor, the right fit, things like that. And so I do think social media is a good platform because at least it could tell them what to expect. And so I cannot tell you how many patients has told me, you know what, I saw this online and I said maybe I should go see someone or maybe I should go
Mhm.
check this out because they feel maybe comfortable online before they even approach a provider or things
Mhm.
like that. So it's very important we have this information out there, whichever way to get patients' attention or people's attention, that way they can know the appropriate step to seek care.
Mhm. That's Wonderful, right? I mean, I can just feel in your heart how important this is to you. And I would
Yeah,
imagine for your husband as well, this is a real passion project. Because I'm sure
yeah.
you don't have days and days of free time every week, but this is a passion project. You want people to have good information. So, how can consumers sift through that fire hose or that wildfire? How do people find? I I mean, I think your offering is one of those, but how can they find you and people like you? And how do they know this is good information versus not?
Right, right. That's a very good question, right? Because everybody's on social media, and it's important to know that like the information you're getting is something that is like evidence-based. It's someone that's skilled to provide this information, which just differs from just people just giving like advices. And so, most times you have like professional website bios whereby people tell you what they specialize in, right? And you could see their training, their accreditation, and things like that. I think it's very important for us to do our own research, right? It's very important for us to do our own research to make sure when we are having any referral is from like a trusted source. Very, very important. And then like most of like social media is not medical advice, right? It's not medical advice. And that's one myth I always want to correct, because some people say, you know what, I looked up this on YouTube and this. And so, any reasonable provider will always tell you, you know what, ultimately, yes, this is like information about this, but ultimately, I want you to consult with your provider. Why? Because there's a lot that goes into evaluation. There's a lot that goes into getting to know you as a patient, as an individual. There's a lot that goes into like learning your history, and those things you need like more than just like information, but also clinical judgment that is assessing you to make those calls. So it's very important that we don't just run off with things we see online, but also do our research. And also, when by doing our research, maybe looking online, seeing are this people is this person versed or have that scope of practice of what I'm looking for, then you'll be pointed to the right direction. It's very important to do that.
Absolutely. Yeah, right. Finding someone who is credible. And how do we know they're credible? Well, if I wanted to know if you were credible, I could go online and I could Google you. And I
Absolutely.
could see that you have credentials and you are
Mhm.
licensed in a
Right,
state, at least one state, if not more. You can
right.
look up somebody's license in the state where they're practicing. You are a
Mhm.
trained mental health professional. And folks, I'm not going to even begin to say that I don't have a bias here. That's a double negative. I do have a bias, which is mental health. It seems easy. There are a lot of complexities. So I love that I can hop on and maybe watch a reel of someone who is talking about mental health and they're saying, go
Oh,
get help. But if you are taking clinical advice from somebody, please make sure that they are a licensed provider and that they
absolutely.
have training in mental health, which is what Dr. Ehirim is talking about. And it sounds like that's true for Vincent as well. So I think that's great advice. Thank you for that. So if someone listening wants to engage with your talks or start something themselves, what advice would you give them?
Honestly, I would tell them to start. I will tell them to start, right? This is a journey, and we need more people talking about this, right? We need more people talking about this. It's never enough, right? And it starts with just you as a person, as an individual, right? Make yourself approachable. Make yourself being able to listen when people come to you to talk about certain things, right? When you make yourself that way, people can be vulnerable with you, right? And even if you don't yet have the right credential, or even if you know you're not the professional, you have what we call supportive care, right? Whereby you could support people by listening to them and pointing them to the
Mhm.
right direction, which is the professionals. Most times, right, especially with stigmatization, you don't hear people jumping out to say, I just went to see a provider. There'll be like one, two, three things preventing them from making that step to see a provider. So by having this conversation and possibly reaching maybe a sibling, maybe an auntie, maybe a neighbor, right? those trusted individual or support system in their circle, we have higher chances to have more people talking about these things. And it's like, you know what? The next step, go seek professional help, right?
Mhm.
So yes. So if anybody, they're always welcome to join the community. I do believe like the more we are, our voices can be heard even more, but it starts with you as a person.
Mhm.
Make sure that you can be approachable, people can feel safe with you, whereby they know they could reach out and then you can point them
Mhm.
to the right direction, which ultimately is going to be the professionals who are trained and
Mhm.
skilled for this.
Mhm. Mhm. Excellent information and advice. Dr. Jayne Ehirim, thank you so much for sharing
Thank
this
you.
information, your wisdom, your time, your kindness. Folks, if you can't see Dr. Ehirim, she just has the most lovely smile, gentle presence. And again, we'll have the information for your community in the show notes so that if people want to connect with you, want to find
Absolutely.
out more, they can do so. But thank you so much for joining us. And folks who are listening, thank you. Please join us again next time where we'll talk about more resources and direction for how to get mental health services if you need it. But in the meantime, take good care of yourselves and be well.